Hello everyone. Let's talk about ethics in this lecture. I think ethics is not only important to nursing informatics professionals, but it is also important to everyone in the healthcare industry. So let's talk about some ethical issues from a general healthcare perspective in this lecture. Before we move forward, we need to differentiate ethics from laws. Legal regulations raise the required standards that everybody should follow. If a person doesn't follow, then punishments will be given to the person. For healthcare, there are some important laws. For example, HIPAA, HITECH, and so on. We'll talk about these legal regulations for healthcare in greater details later in this semester. But in some cases, there are no clearly defined legal regulations. At that moment, we need to refer to some standards that are broadly accepted by the society in order to make a right or wrong decision. We call those broadly accepted standards ethical standards. It's simple to define ethical standards, but in practice, we are frequently facing some situations in which we couldn't immediately make the right or wrong decisions. We call those situations ethical dilemmas. Let's see some example. Allison is a charge nurse in a hospital. She wants to meet a professor from a local university in order to discuss some assignments for the nursing students in her hospital. But when the professor arrives, a patient that Allison is taking care of is developing some critical medical conditions. Allison needs to take care of the patient immediately. In order to speed up the discussion with the professor later, Allison gives this professor her username and password to the hospital's EHR system before she leaves to the patient's room. I have two questions for everyone. Is this legal? Is this ethical? Let me give you about 1 minute to think about your answers, and then I will share my thoughts with everyone. This is a tricky situation, right? First, let's talk about if Allison's behavior is legal. Clearly, Allison violates the hospital's policy for protecting the patient's privacy information in a EHR system. Also, her behavior violates some legal regulations like HIPAA's regulations. According to HIPAA, anyone who can access to the patient's privacy information must get the healthcare organization's authorization. Allison receives her login credentials to the EHR system, but it doesn't mean Allison can give her credentials to anyone else, like the professor from a local university. Second, let's talk about if Allison's behavior is ethical. Some people say Allison is ethical to some degree, because she wants to take care of the patients in crisis as soon as possible. So she has a good intention. But other people may say Allison's behavior is not ethical. Why? Because while Allison is taking care of the patient in crisis, she put other patients' privacy information at risk. So it's not an ethical behavior from that perspective. Now we are facing an ethical dilemma. What should we do? There are several ways to look at this type of ethical dilemmas. My suggestion to everyone is you always look for the legal regulations first, and then develop the alternative decisions. For example, Allison can go to take care of the patient in crisis, and then let the professor wait. Then they can talk about the assignment projects later. Or another alternative is she can ask one of her staff members to discuss with the professor while she's taking care of the patient. And then later they can talk about the assignments together. So this could be a good solution to this ethical dilemma. Like what we learned in the previous lecture, more and more new technologies are being used in healthcare. For example, many healthcare providers are using social media to connect with their patients. They want to provide emotional support and health awareness information to their patients through social media. This is a very good use, but social media can be abused. For example, a new college graduate just got a job in the nursing informatics department in a hospital. He wants to post some EHR system screenshots in order to impress his friend on Facebook. Clearly, he violates the legal regulations for protecting the patient's privacy information. But what if he covers the patient's name, age, and other privacy information? Can he still post the screenshots of the EHR system on Facebook? He'd better not. Because if you post something online, it can be shared very quickly. If a person in this employee's social circle happens to have similar medical conditions and finds these screenshots online, this person may project that his privacy information has been hacked. So this sharing behavior may bring some unnecessary lawsuits to the hospital. We also learned other new technologies like mobile tech and cloud computing. With these new technologies, we can get closer to the patients. We can remotely detect their medical conditions like heart rate, blood pressure, body temperature, and so on. We call those data biometrical data. As a matter of fact, we have developed several ethical standards for dealing with biometrical data. We call those standards bioethics. There are several models existing in practice. I want to use Hastie's bioethical decision-making model to talk about how we can implement ethics when we deal with biometrical data. The Hastie's bioethical model looks at 6 aspects of ethical issues. They are autonomy, freedom, veracity, privacy, beneficence, and fidelity. I want to use an example to talk about these aspects one by one. Let's say a doctor prescribes a smartwatch to a patient. The doctor wants to use the smartwatch to detect the patient's heart rate remotely. The first question we want to ask is, does this smartwatch have the legal authorization to access to the patient's biometrical data? If everything is legal, then we need to look at the ethical aspects of this smartwatch. The first aspect is autonomy. Autonomy means the patient should have the right to make his or her own decision. The second aspect we want to look at is freedom. Freedom means the patient should have the ability to make choice. Based on these 2 standards, we need to evaluate if using the smartwatch is necessary or not. If this is optional, we shouldn't push the patient to pay for the smartwatch just because our hospital can get more money. The third aspect we want to look at is veracity. Veracity means the patient should be able to know the truth. When we prescribe the smartwatch for the patient, in addition to the benefits the patient could get, we need to let the patient know the potential risks. For example, his or her biometrical data can be lost, can be hacked. We need to tell all the information to the patients. The next aspect is privacy. When we give the smartwatch to the patient, we need to consider potential cybersecurity issues. So we need to develop the countermeasures to protect the patient's biometrical data in this smartwatch system. The next aspect is beneficence. Beneficence means we prescribe this smartwatch for the patient's welfare. We want to help the patient to get better healthcare, not for getting more money. The last one is fidelity. Fidelity means we should accomplish what we promised to a patient. If we say a patient's biometrical data is safe with us, we need to strive to achieve this goal. These are the ethical issues you need to pay attention to when you deal with the patient's biometrical data.